Hi, everyone. I'm Michelle Cowles, Director of Business Development at Rogers Behavioral Health. We're so glad you could join us today for our Facebook Live Q&A on motivating children and teens as they go back to school during COVID-19. Today we have with us Rogers Dr. David Jacobi and Dr. Joshua Nadeau, who will be answering questions that are on the minds of many parents and educators right now. Please feel free to comment with your questions and we'll do our best to answer them at the end.
Thanks, Michelle. So like you said, I'm Dr. Josh Nadeau. I am a licensed psychologist and the clinical director of our Tampa facility. Although I am a clinical psychologist, I'm a school psychologist by training. So this is a topic that's near and dear to my heart. And we've been getting a lot of questions and interest about it. So I'm really excited to be here today.
Great. Yeah, thank you also, Michelle, for hosting us today. Again, Dave Jacobi. I work primarily with our kids with anxiety and related disorders. So we certainly see a lot of school-related anxieties and stresses in advance of the school year. So I'm very excited to provide some information for our families and even for our kids and educators if they're watching.
Okay, excellent. And I know we're in different locations. We're on Facebook Live, so we're probably in many different states. I am in Wisconsin, and my children are preparing to go back, a kindergartner to a regular classroom face-to-face with masks. And my high school son will be doing a model where he goes every other day, and the other days virtual. But I know other states are they're doing it 100% virtual. So I know there's a lot of different angles here, but what are some common tips that can help parents prepare their children for this very different type of school year?
That's an excellent question. I mean, there's a lot to be said there, but I think if we boil it down, there's kind of some rules of thumb that I have when we talk about almost anything. And that is the first is to be approachable. The second is to be honest. And then the third is to be brief. So when I mention approachable, look, if your kids come and talk to you about something that's a difficult thing for them, and you tend to be cranky, or freak out or have an anxiety attack of your own, your kids are going to stop coming to you and asking you things like this and letting you know how they feel. By the same token, be honest. And a couple reasons for this. The first is, I promise you're not nearly as good a liar as you think you are. The second is that you can kind of lose your street cred as a parent. So, I mean, we see this a lot with things like separation anxiety, where kids will come in and say, I'm scared that, mom's going to die or that the dad's going to run off. And we say things like, no, I'm sure it will be fine. Are you really? Because what happens if you tell them things are fine and then, gosh forbid, you get in a car accident or something? And now not only are you hurt and everyone's worried, but you're a great big fat liar now, too. And your kids won't believe you anymore when you tell them this. And then that third piece about being brief, I would say that it's okay to be honest and talk about anything. Perhaps don't dwell on it. And what we find is that the more time we kind of spend doing what psychologists call perseverating and the rest of us call getting stuck, talking about this, the more it kind of begins to consume every conversation during the day. So, I mean, those are the three things that come to mind. What do you think, Dr. Jacobi?
Yeah, I mean, we always encourage kids, especially as we're thinking about the transition to school, to be able to talk about concerns that they have, right? So being open, as Dr. Nadeau was saying, is really important. We talk about validating some of those concerns as well. So being able to listen and understand, ask questions, so that you're kind of clear on what it is that the child is potentially struggling with or what they're concerned about, moving into the year. And that also then not feeling like you have to resolve it, to figure it out for them, but that you can kind of work more collaboratively with them to kind of figure out a way forward in terms of making that transition back to school.
Nice.
Great. So it's okay to say, I don't know the answers, but we'll work through this together. Yeah.
Those are the three most powerful words in the English language. I don't know.
Yeah. Well, I imagine depending on the child's age, whether they're starting kindergarten, entering middle school or in high school, or making that big transition to college, every child's way of responding to these new environments is different. How can parents navigate supporting their children who are at different ages?
Yeah, there's certainly going to be a different way that parents and caregivers can kind of respond to the stresses and the anxieties expressed by their kids. Obviously, younger kids are going to need more hand-holding. I'm a big sort of fan of being able to, visit the school talk to teachers in advance. It's okay to sit down with the child maybe in advance and say, what are some of the questions that you'd like to ask your teacher, right? So that the child has some predictability. They get to know the school, the teacher. Obviously, that may be something that we need to do virtually these days, but that can really kind of take away some of that uncertainty and stress that these kids are anticipating. It's also okay, I think, to do a bit of a practice run, so encourage kids who are sort of in the younger age ranges to, go through the process of getting up at a certain time, getting dressed, hopping in the car or whatever it might be and driving to school so that they kind of know what that process is going to look like. For, kids who are more that middle school into high school, you want to normalize some of this anxiety and stress that they're experiencing, right? It's normal to feel anxious about something that's uncertain. The school year is inherently uncertain. So it's okay to normalize those feelings and say, hey, I get anxious too. I get stressed when I'm thinking about, starting a new project at work or starting a new job. As we mentioned before, validating those concerns, validating any of the concerns that the child may have about making that transition, making friends, academic requirements, things of that nature. And then, one of my favorite things too is to help them problem solve as much as you can situations that are novel. Can we sit down together and try to work through what are some ways that we can approach these potentially difficult situations so that they're more controllable for the child? We want them to have some sense of control as they kind of navigate this kind of new experience in their lives.
Yeah, it's an excellent point. The other thing that comes to mind for me when we talk about the difference between younger kids and older kids is that for older kids, one of the cool things is that you can help them look back on the times they've been anxious before and been successful when things change. And one of the hardest things for the younger kids is they just don't have that life experience, which can be a good thing or a difficult thing. So, but yeah, absolutely, I agree 100%.
Yeah, and the other thing too, just to add on to that is, oftentimes we're talking about anxiety and stress, kids being apprehensive about making that transition back to school. But what are the things that they really enjoy about school? Being around other kids, or at least virtually interacting with other kids, being involved in extracurricular activities, just being more active and connected to something else that's bigger than themselves is oftentimes something we can help parents to help their kids focus on.
Thank you. And that ties into our next question. What if you notice your child's reluctant to try their new school scenario? And what general tips do you have for parents in supporting their child through these emotions? If they say they don't want to go, they say they don't want to wear a mask, they say they're not going to do their homework from their kitchen table anymore. How do you talk this through with them?
That's huge, and I love the fact that Dr. Jacobi brought up this concept of validation, and that to me, one of the biggest things that we can do is understanding and recognizing how legitimate it is that your kids and the rest of us are unsure and uncertain of what's about to happen. And I think, as with any situation where we think about when emotions run high, it's really, really important to hear what people are trying to tell you about what their experience is. I think, for any of us who've been in any sort of a relationship, if our partner comes back and says, I had an awful day and this happened and that happened and my shoe broke and it rained on me, they're not looking, for the most part, for you to come and tell them what they should have done differently or how to solve that problem. People are pretty good problem solvers usually, but sometimes it's a little overwhelming. And what we really need is for somebody to say, boy, that sounds like it sucked. And kids are no different. It's great to give them some tips on your lived experience, but one of the biggest things that you can do for them is validate the fact that this is a really difficult and challenging and sometimes terrifying time if you watch the news. So as we talk about this, it's less about fixing the problem and more about hearing the emotional experience. And so for me, in terms of a tip from a parental standpoint with my own child, I think the algorithm we look for here is to step in and validate and say, oh man, I hear what this is that you're saying. To ask, what do you need from me right now? I'm happy to give you some tips on this, but if you just need me to listen to how tough things are right now, cool, we can do that. And then the third is that if you've asked and they've said yes, you offer that support, you offer those tips and let them know that it's okay to bring this up to you. And I think it's something that probably as a society we don't do as well as we should, but it's really important when you talk about these situations where emotions are really, really high, and we look at what we call lability, so where we kind of shift from one mood to the other very rapidly.
Yeah, and I would certainly add with validation, it is about just being able to understand their perspective on this. And if you don't understand, ask questions. It's great to say, help me understand why it is that you're struggling with this or why you're having some issues, so I can really be supportive and helpful in this process. And then also the idea that, Dr. Nadeau had mentioned this, but, don't feel like you have to solve all these problems. Ask the child, what are some thoughts that you have about being able to manage this and to be able to work through this? And then how can I help potentially in that process, so that we're working collaboratively to come up with a way for that child to move forward.
Yeah, so just, I hear you. It's sometimes so hard when you're as a mom in nurturing mode and you want to go straight to like, okay, I'm going to make it better for you. And it looks like we have some questions from our listeners on Facebook. What to do for a 9-year-old who has anxiety about COVID and going onto a school bus and is resisting talking about it, instead seems to be stuffing it down, and then is showing up with increased crying and separation anxiety. And that's about a 9-year-old.
You want to go first, Ed?
Sure. Yeah. I mean, certainly there's a lot of things going on there. The separation piece would certainly be something that a lot of kids really struggle with. So, voicing concerns about being away from home, being away from the parent. And then, part of that is being able to normalize some of that concern, right? Validate. So we just talked about, acknowledge that the child has some of those concerns. If they've had any experiences with, going to school in the past, having some of those concerns, preceding school, again, I think as Dr. Nadeau had mentioned, how did that go? How did that work for you in the past? Did you find that after a few days you were able to adjust to being at school? You enjoyed the process after that and were okay with that? More specifically about the COVID concerns, certainly part of the process for me is to know what is the school's plan with that. How are they going to handle the 6 feet of separation and mask wearing and hand cleaning and things like that. So there is some predictability, appropriately so, for that child in terms of knowing what to expect when they're in the classroom setting, knowing what to expect as they're traveling on the bus. What is the protocol in place for that? So having some plans in place, having a strategy, being able to kind of recognize it's likely in the past the child has been able to work through these issues, even though they've had some of those kind of anticipatory anxieties, and then just be able to kind of validate that and move forward.
Yeah, that's excellent. I mean, I'll jump in there as an anxiety therapist myself and say that one of the things that we like to do as a knee-jerk response sometimes for parents is when our kids tell us they're scared of something, we try to tell them, well, you don't need to be scared of that, or don't be scared of that, or worse yet, how many times has someone told you, well, that's a stupid thing to be scared of? In terms of how helpful or not, that's pretty firmly in the not helpful category. So, as we talk about this, when you think about your 9-year-old getting on the bus, and of course it's COVID, so he's got all the zombies on the bus, maybe that's the fear. The question is, what do you think is going to happen? Kind of spend a little bit of time on that, flesh that out. Don't let it be this dark cloud that we're afraid to look at or talk about and avoid like it's the elephant in the room. And then the second piece, I love what Dr. Jacobi said about where we get stuck in the present and we don't think about those previous times where we've been successful. We also don't think about what comes next. Let's talk about how things could go today, but let's also talk about what we're going to do when you get home. Don't get stuck in that pothole in the road that is getting on the bus. Yeah.
Oh. Very good. And so another question we have, are there types of therapeutic techniques parents could try to calm at least some of the anxiety their child might be experiencing with the unknowns of how the full school year ahead may look?
Yeah, I'm a big proponent of the basics. So sleep, getting enough sleep really does help us navigate the different stresses of life. Being active, exercise, getting out, shooting hoops, going for walks, just being active as a child tends to also have an anti-stress sort of benefit. Eating right. I know it sounds kind of minor, but there was a movie out about 15 years ago called Super Size Me, where the gentleman ate McDonald's for 3 meals a day, right? And there was a little side vignette where they went to an alternative school, and some of these kids had some behavioral issues, and they made one change, and the change was to introduce healthy foods for their lunches and breakfasts. And they found that the behavioral issues dropped just with that one change. So the power of eating a healthy diet really allows us to manage some of these kind of negative emotions that I think in a more positive way. I'm also a big proponent of family routines and what we call family meals, of coming together on a regular basis to talk about things, right? When you're having dinner with our kids, we can ask them about their day. We can ask them about any concerns that they're having, or they can express them. And it gives us an opportunity to kind of validate, to kind of help problem solve or do different things to really help that child work through those things. So it really does have sort of a protective effect in a sense. The American College of Pediatrics will say, please limit certain violent shows or games. When kids are exposed to that, it does add to their stress and anxiety. Have the child have some control in their lives, making decisions, keep them informed about things that are going on in the family. They're going to feel more, or should say less stressed, less anxious when they have more control in their lives. And then certainly having a plan, again, as they head back into school in terms of how to manage things can also ease some of those anxieties in the here and now.
I love how you talked about structure. One of the things that, as I worked for a long time in schools, and one of the things that I would firmly remember is just how much kids crave structure. And let's be honest, adults do too. And if you don't believe that, step into a classroom when a substitute teacher is there. And what you will find is the nicest, most well-behaved, meek, mild kids will be hanging from the walls and setting the place on fire. I mean, hopefully not literally, but metaphorically speaking, if you ask the substitute teacher, that's what they'll tell you. So when we kind of talk about structure and routine, a lot of the anxiety that we feel tends to come from not knowing what's going to happen next, not knowing what to expect. And what we'll find is that within reason, what we want to try to do is set ourselves up with some sort of support or structure so that there are things we can rely upon on a day-to-day basis. And it makes it easier for us to deal with those things we can't control.
Yeah, the only other thing I would add is that, when we have a tendency to be stressed and feeling anxiety, there is that tendency to isolate and avoid, right? We stay away from the things that we think are provoking our stress. We just want to be kind of by ourselves to kind of deal with these things. If you find that kids are doing that, they're spending more time by themselves, we certainly talk about something called behavioral activation, getting them out and doing things. And these can be things like routine activities, just doing chores around the house. It can be fun things, watching a movie, going out shooting hoops, doing things like that, or even valued activities, right? Volunteering, spending time with friends and family. Getting people out and activated seems to be a great way for them not only to improve their mood, but to manage their anxiety and stress more effectively.
Excellent. Yeah.
Yeah, great reminder. And sometimes as parents, or as a parent for me, we forget about the structure piece and how important it is for our children and the well-being. So that's a wonderful reminder. Another question that we have, what if a child has existing mental health struggles? Is there anything different parents should try in that scenario to help set the child up for success?
Do you want me to take that, Dr. Nadeau?
Sure, yeah, go ahead.
Sure, yeah. So, if they have mental health struggles and if they've been through treatment, I guess I'm making a bit of an assumption here. Many of the treatments that we provide are what we call very skill-based. You're learning different ways of managing your anxiety and stress that you take with you and that you're able to apply in situations that are challenging for you, such as potentially returning to school. So am I able to apply those skills in the here and now to help me manage through what might be a very difficult time for me? I'm a big fan of what we call a coping card, which is simply a 3x5 card that has different reminders on that card about, my ability to manage. What can I do to manage when I feel that the physical sensations of anxiety? What are some reminders that seem to help me weather some of these difficult situations? What other skills have I used in the past to help me navigate these difficult times? The other thing that can be really important if the mental health issues seem to be kind of rearing their ugly head is, do I need some therapeutic support? Do I need to talk to an outpatient provider? Do I need to go and see somebody in an intensive program, before school and then as they transition into the school year? Just to have that support, to have somebody who can help remind of skills, help them manage those situations more effectively so the child feels, confident and heard as they kind of navigate those, first, maybe couple of weeks of school.
Yeah, agreed. I think the two of the biggest questions that we get asked are, I guess the biggest question we get asked in terms of treatment is, are we ready to leave? Are we done with treatment? When am I done with treatment? Am I ever going to have to come back? And it turns out that two of the biggest predictors of people having to come back and do this is to what extent they're able to show these skills they've learned in treatment in settings outside of the clinic. So can I go to school and do the same things I was doing in our facility? Can I go to church and do the same things that I've been doing? Can I go home and do the same things I've been doing? Can I get along with my brother or sister the same way that I've been able to get along without them? And I think the second big piece that gets lost is one of the things that you have to become aware of are what are your warning signs? When do you know that you need more help? And that's kind of one of the things you just hit on there, Dr. Jacobi. And it turns out those two things are huge. And so the more that we're able to kind of attend to those signals coming from inside to let us know when we need help, and the more we're able to recognize situations where we can bring those skills we've learned to play in new ways, I think the more successful we're able to be.
Yeah, and I would say just piggybacking on top of that is, it's okay and it's very helpful, to work with the school to have a plan in place. And again, this is probably going to be temporary as the child adjusts, but what happens if the child becomes more overwhelmed in the school setting? Is there a place they can go to just sort of unwind a little bit for a few minutes and then come back into the classroom? Is there an individual, a school counselor or a teacher that they can connect with if they're having some struggles to kind of help them work through some of these issues? So the prep on the before school, before they go to school, and then having people at school to kind of help them work through some of these issues can also be helpful.
Wonderful. I noticed on the video that for my son's kindergarten class that was sent out, they had a sensory area, and then they had a mask-free zone with tape on the floor, where if you felt like you need a break from your mask, you can step over there. And I know that you work with schools a lot when you're treating your patients, and it's a great reminder that we can do that as well. And we have so many questions. I'll try to get to as many as we can. The next question is, we have been taking precautions at home, but now that school is going back into session, the school is not following all the guidelines that are out there from the state and county. We have chosen to go virtual. What do you tell your kids that don't understand why we are taking these precautions and their friends have not, nor the school, and they're staying at home and their kids are going to school?
Ooh, that's a lot to unpack. And unfortunately, that's not a rare situation from all that we've heard. And so, it's a really good question, and I think there's really four things to keep in mind here. And the first thing that I would say is you need to remember that there's a reason that there are several options at every different school in terms of how kids come back. And that's because everyone is different, and there is no option that's best for everyone. And if we kind of start there, the rest unpacks itself fairly easily from there. And specifically, any effort that your kiddo is showing in terms of whether it's to go in person or whether it's attending virtually or whether it's kind of feeling as though he's had the rug pulled out from underneath their feet and still showing that effort, you want to make sure that you praise it. You also want to make sure of kind of how you're framing and the language that you're using when you discuss this with your child. Because if your kiddo is not too sure what's going on and isn't too sure how to feel about the school's policies versus what we think is best for policies, and you're using pretty negative, maybe some heated and hostile language about things you'd like to do to their teachers or their schools, that doesn't really help in terms of, your kiddo trying to figure out what's going on and how they feel about it. And I mean, in that respect, what you're really doing is kind of modeling some really strong emotional decision making. Now, I mean, in terms of what you can do, aside from kind of speaking with your child about this, I would be curious and I would reach out to find out if your school is not intending to follow specific policies that have been set by the district or the state or federal guidelines. What is the school's plan? I don't know of many locations, and I'm an optimist, so that I hope this is not going to be an exception to that. But I don't know of many schools where they're just like, cool, let's open the doors and see what happens. So my hope and my assumption is that there is a plan in place, and that schools are not always the best at communicating that clearly to parents, particularly when it's something that we're anxious about and how that's going to impact our family and our child. So remember to keep those lines of communication open and not to assume that there is no plan when you don't know what the plan is.
Yeah. And I would just echo that very strongly, that it's really part of the parent's responsibility to kind of ferret those things out, and then kind of deal with what decisions that parent is making for the child, whether to attend in person or attend virtually. Then we can kind of manage from there.
Okay, great reminders. Here's another question from a viewer. What suggestions for kids and teens dealing with lack of socialization provided by school? Many schools are offering hybrid models where they are in class twice a week. Any suggestions to maintain their relationships and the social piece?
Yeah, I mean, from watching the kids in our programs who've been involved in virtual school these past several months, they really have had to make an effort to reach out to other kids virtually, to have that contact, to set aside time to do that, to meet with kids as they would if they were in in-person school. So it's not perfect, but there has to be some effort made to make those connections, to keep that kind of social piece vibrant for that child, because we really are seeing in our programs that the kids need that. They need that connection, and part of their anxiety, part of their kind of issues with mood is really losing that connection to other kids, losing that connection to the routine of going to school and interacting with teachers and classmates and so forth. So we have to do our best to try to recreate that the best we can.
Yeah, excellent. The only thing I would add to that is when I think about really old people like myself, not a young buck like Dr. Jacobi, when I think about when I was growing up and what our social relationships were like and how we, kind of interacted with our peers, and I might be gone from sun up to sundown. And I think about my child's generation and kind of what social interaction looks like. It's very different. And I don't want to say that those things are the same, but I will say that it's pretty good odds that my child and the folks growing up right now are in a better position to be able to buffer against these changes socially, because the nature of their social relationships is quite different than it was back in the Stone Age when I was growing up and riding a pterodactyl to school. So, yeah.
Yes, so much difference, nothing really to compare. This is a question that came in. Would you ever ask kids what they need to feel comfortable and okay with going to school? So asking your kids if they're okay with going to school rather than directing them what they're going to do next.
Yeah, so yes, and yes, I will always ask kids what they need, but there's a trick to how we ask that question. So I love my boss. I don't love my boss, but I respect my boss. I enjoy working for my boss. I've never known my boss to ask me, do you want to do some work today? That would be a really ineffective way of getting me to go to work. It's kind of like if I am waking my child up, I don't say, hey, do you want to get up or do you want to clean your room? Mm-hmm. I think a much more effective question is actually how you worded it in the question, which is, hey, I know we have to get you to do your school today, or we have to go to school, or we have to do virtual, or you have to clean your room, or whatever it may be. What can I do to help you with that? What do you need to be successful in that endeavor? I think that's a very different, empowering question rather than one that opens the door to escaping from a task. Yeah.
Yeah, I would agree with that.
Okay. Is there anything else that you might like to add as we wrap up and try to navigate through this this different way of going to school and this new normal?
Yeah, what I would add is, we do our best to try to normalize these experiences. So we're talking about heading back to school now and the anxieties in the time of COVID, so to speak. But these are still issues that occur every year for kids, no matter how old they are. There's going to be some anxiety about the unknown. These kind of normal, what we call stresses, are transient, meaning once I get back into school and interact with the teachers and classmates and get into that routine of getting up and getting to school and doing what I need to do, you're probably going to find that stress tends to abate on its own, right? I'm feeling better. I'm feeling more confident and comfortable as I go through this. So part of this is not to kind of over-pathologize, in a sense, any of these issues, but really talk about and use some of the skills and interventions that Dr. Nadeau and I have been talking about to kind of minimize the impact on the child, to encourage them, to help them through that process of getting through the anxiety. Anxiety is not a bad thing, right? We all experience anxiety, and in many instances, anxiety actually helps us perform even better than if we're really too calm or overly anxious. Mm-hmm. So there are certainly some benefits to that. What we want to be mindful of, and particularly with what Dr. Nadeau and I do, is when does it become a problem, right? So it becomes a problem when it becomes overly distressing, when there's some measure of impairment, right? The child's not able to go to school or really having a difficult time transitioning between home and school each day. There's a drop in academic performance. There's isolating and just avoiding other classmates or avoiding life in some way. Then it may be time to talk to somebody who's a professional about some of these things, to offer some interventions that kind of help manage these or help the child manage some of these difficult situations.
Yeah, that's a great response. I couldn't have said that better. The only thing I would add to that is that it's really easy right now, given kind of the things that are going on and all the things that we're trying to deal with across the country right now, to think that you're alone in this. And to feel isolated. And I never forget for an instant that everyone is dealing with this, and we may deal with it in different ways, and we may have different solutions to that problem, but never forget you're not alone in this. And one of the things I really love about how you phrase this question is the new normal, because whatever normal is going to look like a year from now, I promise it won't look like what it did a year ago. And as Dr. Jacobi brought up, the next year, it will be something else. It'll be raining fish or something like that, and we'll figure it out. So.
That's such a great reminder and source of comfort. And I know Rogers is here to help, and we'll put in the comment section a number that you can call. And also I'll go over the website at the end. But thank you both for such insightful guidance and your time, taking time out of your practices to be with us today. And it's all the time we have. If we didn't get to your question, we will get to it. And you will hear from someone at Rogers. So thank you so much for joining us and for sending your questions. We hope that it was helpful. And for more information on the services Rogers provides, visit rogersbh.org. And there's also helpful resources on the website, like videos and blogs on a variety of topics. That's rogersb as in behavioral, H as in health.org/resources. Thank you very much and stay well.
Great. Thank you, Michelle.
Thanks, Michelle.